Good morning. My name is Saria and I am a Chicago school nurse. I'm here today to say a few things about my experiences with the Healthy Schools campaign and the School Nurse Leadership Program. But first, I want to thank Rochelle and the Healthy Schools campaign for having me here. It is an honor for me to speak here in front of you. When I begin to talk with people about school nursing, the first response I usually get is, I didn't even know they had school nurses. Your job must be easy. All you do is take care of nosebleeds and paper cuts. I usually cringe when I hear that response. And I begin to talk about the diabetic students that I service, the health plans that I do, and the special education meetings that I attend, and how I am the health expert in the school. And yes, a small part of my job is to give out Band-Aids. But it is much more than that. And with help of the Healthy Schools campaign, I have found how much wellness can play a part in the work that I do. I've been working at CPS for 3 years. Working at CPS is rewarding yet challenging. Being a school nurse requires one to be flexible and the ability to be autonomous. I even had the opportunity to bring a salad bar to one of the schools that I service, and I was able to discuss this at the meetings. Working as a school nurse, you can definitely build character, and you learn how to count your blessings when you observe what some of our students have to endure every day. In a typical week, I can cover over 1,200 students at 5 different schools, which means 5 different personalities and styles. I visit 1 school a day. Sometimes I can visit up to 2 or 3 schools. As you can see, there's definitely a need for more nurses, but that is where the Healthy Schools campaign comes in. The 9-month, 3-day training helped us to work within our unique situation, and the trainings allowed us to interact with other CPS nurses who face similar issues, and we were able to discuss how we can inject wellness into our busy schedules. Now I try to think, how can I express Healthy Schools campaign, School Nurse Leadership Program, to prepare me to be a better nurse. So I came up with this acronym, School Nurse. S, Scholarship. How to provide services using evidence-based practice, as well as utilizing the policies and procedures in place to enhance the students and staff wellness. C, Conscientiousness. Discovering how wellness, health, and academic achievement are linked, and how we can become aware of the school wellness when we completed the school health index on our first day. H, Health Promotion. Uncovering new ways to promote health in school. For example, creating wellness plans, promoting breakfast in schools, and the salad bar. O, Opportunity and Exposure. We had the opportunity to write mini grants and participate in health activities like the School Nurse Advocacy Day. Furthermore, we're exposed to wonderful amenities and an excellent model of healthy eating at the meetings that can easily be transferred into the school setting. O, Originality. Gives us the opportunity to think outside the box and be inventive. This is a unique opportunity to discuss and emphasize primary prevention and how to be proactive in the school setting. L, Leadership. Assert our roles in leadership. Use our voice to promote wellness and how to promote what school nursing is. We are leading by example. N, Networking. I met so many nurses that felt the way that I did about wellness and preventive health that I didn't even know existed. It was an eye-opening experience. U, Unity. Promotes working in collaboration with one another and teamwork. R, Resources. How to obtain funding. We received a CD full of resources and free activities that we could use in our schools. We also had 24/7 access to the Healthy Schools campaign website that is full of current, up-to-date information and a discussion board. S, Strategies. How to devise a wellness plan. We outlined how to devise our wellness teams and collaborate with administration to enhance and ensure the best outcomes for our students. E, Encouraging and Educating. We helped each other and learned from each other. Over 3 days, it was intensive and educational, but this training helped delve into the aspect of school nursing and wellness that we didn't have an opportunity to see before. You left away with a feeling that I could do this. It was empowering. Healthy School campaigns a network of individuals that are supportive. It's also obvious that Healthy Schools campaign recognized that school nurses are underutilized in our school system, and they devised a well-thought-out plan to address this. See, I specifically went into school nursing because I want to provide care to children and communities that are overlooked and underserved. The skills I have developed and opportunities I've had through the Healthy Schools campaign has enhanced not only my life, but the lives of the children that I serve. Healthy Schools campaign has set a foundation for us to build upon as nurses that will benefit our students, and especially what we can teach them, and in turn, what they can teach someone else. Thank you.
Saria, just to understand the depth of her commitment to her student, she attended the first day of our session 2 weeks after having a baby. So